So now let's discuss about the parenteral route of administration, that is another route of systemic route of drug administration. The parenteral word came from a Greek word par and enteral, that means beyond the intestine, and in this the drug are injected by injection which take the drug directly into the tissue fluid or blood without having to cross the enteral mucosal membrane. There are different routes of parenteral routes: subcutaneous, intramuscular, intravenous and intradermal route of drug administration. Now let's see what are the advantages of parenteral route. Drug absorption is faster and surer. As soon as it reaches the systemic circulation, it will produce their effects, and 100% it will reach to the systemic circulation. So it will increases the bioavailability also, and we can avoid the first pass metabolism since it will bypass the liver by directly injecting to the systemic circulation. We can avoid the gastric irritation and vomiting, and can be employed in unconscious and vomiting patients, and no chance of interference with the food or digestive enzyme. So these are the advantages of parenteral routes. Now what are the disadvantages? Preparation has to be sterilized during the manufacturing and during the before the use. So it will be costlier when compared with the oral dosage form, and technique is invasive or painful, so need an assistance of a qualified person. Though self injection is possible in case of insulin for diabetics, and there are chances of local injury, tissue injury, and they are more risky than oral route and cannot be withdrawn once it is administered. That is the only one major disadvantages of parenteral route of drug administration. Once it is administered, it is directly administered into the systemic circulation, so it cannot be withdrawn. So it will be very cautious before administering parenteral preparations. Now coming to the first route of parenteral preparation, that is the subcutaneous route. In this, drug is deposited in the loose subcutaneous tissue. Irritant drug cannot be injected because this area is richly supplied by nerves, and absorption is lower than the intramuscular injection because there is less vascular, and only small volume of injection can be injected. Self-injection is possible because the deep penetration is not needed. Now coming to the intramuscular injection, this injection is injected into large skeletal muscle like deltoid, triceps, gluteus maximus and rectus femoris. Mild irritant drug can be administered because this area is less richly supplied with the nervous system or sensory nerves, and absorption of drug is faster when compared with subcutaneous because which is more vascular, and it is less painful, and but self injection is often impracticable because deep penetration is needed. Only small volume, maximum of 10 ml is possible. Chance for nerve damages are also there, and some depot preparations which are prepared by oily solution and aqueous suspension can be injected by this route of administration, that is the intramuscular route of drug administration. Now coming to the intravenous route of drug administration, this is the route which will give 100% bioavailability, and in this route can be injected as a bolus, as a LEM in a short period by directly injecting into systemic circulation over less than 50 ml or less than 10 ml. It can be infused slowly over hours in one of the superficial vein. Drug reaches directly into the bloodstream and effect is produced immediately when reaches to the systemic circulation. So it can be great value in the emergency condition. Even highly irritant drug in large volume can be injected since the intima of vein is sensitive. There is no nervous system in the intima of the vein, so there will not be any irritation. And also large volume also can be injected up to 1000 ml in 3 to 4 hours because drug will get diluted with the blood. And any type of drugs like hydrophilic or lipophilic drug also can be administered by intramuscular injections. Now another route of drug administration is intradermal injection. In this, drug is injected into the skin by rising bleb. For example, BCG vaccine, sensitivity tests like tuberculin and Chick, on scarring multiple punctures of epidermis through a drop of drug is done. So these are the different routes of parenteral route of drug administration. So this is the picture which will show the different direction of parenteral routes. This is 90 degree and subcutaneous is 45 degree. Intravenous is approximately 25 degree and intradermal is 10 to 15 degree. So this is the angle of injection in the parenteral preparation, and these are the different volume of each route of parenteral routes and their properties. For subcutaneous route, we can administer 0.5 to 2 ml of volume with using a needle of 20 to 23 gauge, and the injection should be isotonic. What is isotonicity? Isotonicity is nothing but the solution should have an osmotic pressure as that of the blood. So what will happen if the injection is not isotonic? If it is hypertonic solution, it may lead to hemolysis. If it is hypertonic solution, it may lead to crenation. Hemolysis means lysis of blood, and crenation means the enlargement of shrinking of the RBC. So that is the problem with isotonicity. So every injection should be isotonic with blood. That means it should have an osmotic pressure as that of the blood, and it can be adjusted with 0.9% sodium chloride solution. So subcutaneous injection, example of injections are insulin and vaccine. Now coming to the intramuscular, up to 0.5 to 2 ml can be injected using 23 gauge needle. Need to be isotonic, oily suspension and emulsion can be administered. Nearly all classes of drug can be administered, whether lipophilic or hydrophilic drug. Now coming to intravenous injection, up to 1 to 100 ml by using 20 to 23 gauge syringe. We can administer solution, emulsion, liposome. It also need to be isotonic. Nearly all class of drug can be administered. So this small volume of parenteral preparation is known as small volume. Less than 100 ml parenteral preparation is known as small volume parenterals. If it is greater than 1 ml and less than 1 liter, maximum of 1 liter can be administered at a time. So that preparation is known as large volume parenterals. So if the intravenous injection is given in the amount of 101 ml to 1 liter or 1000 ml, is known as large volume parenterals, which can be administered by using 18 to 19 grade of syringe needle, and it can be administered solution and emulsion. Nearly all class of drug can be administered by this route of drug administration. So that is all about the different routes of drug administration, topical and systemic route of drug administration. This is the most important topic in the pharmacology, and which is seen as essay, short mark, 5 mark short answers, and as well as differentiate question. So hope it is clear. Thank you for watching this video.